warahmatullahi wabarakatuh. Good afternoon. To the Honorable Excellencies, Bapak Ibu Maja from GIZ Indonesia, Bu D. Suhaya, Regional Director Asia Pacific Alzheimer's Disease International, Bu Tika Wulandari, Behavior Change Communication, Dr. Jesus Corpus Fernandez, Deputy Director of Program Senior Rector, distinguished guests, ladies and gentlemen. Welcome to the panel discussion, Health and Nutrition Promotion in Practice, What are the lessons learned? My name is Tia. I'm honored to be your Master of Ceremony for today. Ladies and gentlemen, now I would like to invite you to listen to the senior song. Ladies and gentlemen, now I would like to invite the representative of Nutritional Science Study Program, Faculty of Medicine, Universitas Indonesia, Ibu Helda Husun PhD, to give her speech. Ibu Helda, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. First of all, thank you to Senior Rector for making this cooperation possible. So within our study program, the subject of nutrition communication, the subject of communication has been taught for long, yeah. taking the name or various names, starting with nutrition communication, and then health promotion, technology komunikasi. Yeah. The reason behind that is because in the competency which wants to be achieved by the study programs, one of them is that the participants, the master students are able to plan, execute, and monitor various nutrition interventions. One of them, one of the types of intervention is always involving communication, both in the clinical settings as well as in the community settings. Yes. So in the clinical settings, maybe it's more on nutrition counseling. In the community settings, it's more on communication for behavior change. But in all the settings, both at the community or at the clinical settings, we always want, as nutritionists, wants to get the message across. That's actually, that is, I believe, the essence of the communication. So we are glad that today the nutrition study program participants are able to listen from the expert, the one who has been working for long in communication field, in health communication especially, so that they can learn hands-on or tips and tricks on conducting communication programs. And of course, also it is the first, this seminar also will enable them to start their networkings with the experts on the communication. So on behalf of the Nutrition Study Program, I welcome you and to the seminar, and thank you for all the speakers who make their times to share with the students, and I hope you all enjoy the seminars. Thank you.
Thank you very much, Ibu Helda. Now, to open up this event, I would like to invite the representative of Director of Simio-Recon, Dr. Jesus Corpus Fernandez. For Pak Jess, the time is yours.
Thank you very much. Good afternoon, everyone. I'm not really sure whether I have to give this remark because Pak Bu Helda already gave a remark. She's also from Simio-Recon. Anyway, on behalf of our director, Dr. Mokhtar, who is now on official function at the Rembuknas, we welcome you all. We gladly welcome you all in this panel discussion on the health and nutrition promotion in practice. What are the lessons learned? Well, I believe we all know how important health promotion is, because it is a process that enables or enhances awareness of the general public, and at the same time increases their capacity to take control over factors related to their health, and in the process enabling all of us as a public to have a healthy lifestyle. Okay? And in fact, it is like some people say, it's like a combination of art and sciences, because like Bu Helda said, it involves communication, and communication has this kind of process to get the message across. And in general, health promotion efforts really require prioritization of an identification of the health problems that we are facing in the society, and purposive or careful planning and purposive communication intervention. So we would like to get the desired behavioral changes among our targets when we do some campaigns. And everybody plays a role. It's not really just people like us in RECFON or UI, the international society, NGOs, and the government, everybody has a role to promote a good, healthy lifestyle. And that's why this is also critical for governments like in Indonesia to have some programs like this. And we have partners, and these are all represented by our speakers here. As a regional center on food and nutrition, we believe and we support the principles and concepts of health promotion, and that's why we came up with this panel discussion. And we thank, on behalf of RECFON, we thank all the speakers who would take their time to be with us. I'm happy to see that the speaker is still young and looks dynamic, yeah? Even though sometimes, you know, people who, most of the speakers we invite and share experiences normally are the old people, but yeah, but the thing is, like, you all look young and still are younger than me, and I'm happy to see this kind of dynamism among the youth, and I hope our study program students would learn from the sharing of our speakers. And I encourage you also to ask questions, because through asking questions we learn a lot more than just listening. Yes, so on behalf of the Senior Center, RECFON in general, and the staff, we welcome you once again, and we hope for a successful seminar. And I officially open this panel discussion. Thank you very much.
Thank you very much, Pak Jess. Pak Jess, please stay for a moment. I would like to invite the speakers to receive the token of appreciation. Please, Ibu De Suharya, Ibu Tika, and Pak Ligil, please come forward.
You have received it before. This is a new edition.
Okay, the photo session, I would like to invite Ibu Helda, Ibu Yudi, and Ibu Iis to come forward. Before we are going to our main session, please welcome our moderator of this panel discussion, Dr. Yudia Stuti, Februartanti, MSc. Dr. Yudia Stuti is Manager of Knowledge Management and Partnership at Senior RECFON. She gained her Master and Doctorate degree in Community Nutrition, Faculty of Medicine, Universitas Indonesia. So, Ibu Yudi, the time is yours.
Okay, thank you. I just had an information that Budi Y needs to be on some other place very soon, so we decided that we make this modification, so there will be like two sessions. One session will be Budi Y, and then the next session, and then Q&A, and then the next session will be Rigil, and then closed by our dear Tika. So I think I would like to let DY herself to introduce herself, because she would have that fabulous moment on telling who she is better than
what I'm going to do. So I think without further ado, I would like Jiwai to share before the video. You would like to video first, okay?
Alzheimer's, a disease of the brain that impacts on memory, emotion, decision-making abilities, and other brain functions, affects 1 in 10 people over the age of 65. It is a growing epidemic in many countries, and Indonesia is no exception. In 2013, 1 million people were thought to be living with dementia. By 2030, that number will double. Despite the significant prevalence, poor knowledge and widespread tendency to think of memory loss as a normal part of aging has potentially resulted in many undetected and untreated cases of the disease. To tackle this, On-Track Media Indonesia and Alzheimer's Indonesia, supported by Grand Challenges Canada, initiated the project Kickstarting Alzheimer's Awareness in Indonesia under the STARS and Global Health Program from 2014 to 2015. The campaign was covered by over 1,000 published news articles and featured in more than 22 regional and national TV and radio talk shows, ultimately reaching out to an estimated 66 million people across Indonesia. Since then, ALZI has continued to hold caregiver meetings, training classes, and other activities such as educating awareness raising for over 10,000 students across Jakarta. Public-private partnership will remain a crucial part of our efforts to improve the quality of life for people with Alzheimer's and their caregivers in Indonesia. For World Alzheimer's Month 2015, electronic billboards across Jakarta will once again show the 10 signs video, courtesy of the Jakarta local government. Public parks in the capital will also be activated to provide a place for risk-reducing activities such as regular physical and mental exercises to support an active aging society. Jangan maklum dengan pikun. Memory loss is not a normal part of aging.
Thank you. The clap should be at the end, no?
Thank you, Ibu Judy, for inviting us. I also would like
Tahukah Anda apa itu Alzheimer? Alzheimer adalah
I would also like to thank you because the other two speakers are dear friends. So thanks to her, we have a reunion today.
It's nice to meet them again in this session and contribute our experience.
So my name is, in the birth certificate, is Kusuma Dewi, the goddess of flower. And if you see me, I don't think I look like goddess nor flower. And I'm a tomboy, and my sister gave me DY as my nickname. And the topic is in advocacy and partnership with trust. And the video, 2-3 minutes video earlier, is representing the experience of how we do advocacy and partnership, not only with government, but also private sector, other NGOs, individuals, and all that. So this is how everything started, actually. My mom was diagnosed with vascular dementia in 2009. And I was pursuing my Master of Public Health in Australia when my dad called and said my mom was diagnosed with malnutrition and dementia. And I thought malnutrition is only in Africa or in East Timor, but it's actually in my house, in my neighborhood. And that's because she forgets to eat, and she also has shown symptoms of dementia, which is a neurodegenerative disease affecting the brain, cognitive, affecting people, memory loss, emotion, and executive decision. If only I knew that my mom, the symptoms 20 years ago, she's already showing symptoms of that. There's so much that we could do beforehand. And I have some flyers, brochures for you to have, so you can share to your family about this. So my mom passed away exactly on Kartini's Day, so her legacy continues. She's my forever Kartini, my sunshine, my inspiration. And because of the lessons of this journey with her, initiated the Alzheimer's Indonesia movement. And Tika is one of the person that actually, it was the first memory walk that we did on the video. She was also actively participating in that walk, an intergenerational walk. And that's the first time we got elderly community to join and all that. So this is, you have it in your PDF, I think, but basically, globally, my mom is 1 out of 50 million people with dementia globally. And out of 50 million in Asia, it's actually around 22.9 million. So almost half of the people with dementia is in Asia. And that's because of the age expectancy. In Indonesia, it's around 72.9. And it's affecting women more than men. And also, it's very costly. It's approximately, for Indonesia, it's approximately around $2.2 billion. And that's for social, for healthcare, informal care as well. These are just graphics that we did as an organization, created a vision, is a center of excellence to provide support, not only for care, but also for risk reduction. And this is where the nutrition component takes part. Because again, like, I still remember that my mom cooked every day for my dad and family, but she actually ate junk food in the afternoon because she's focusing more on giving to the family and didn't really have enough time to prepare nutritious food for herself. So it's approximately 1.2 million people with dementia, estimation, and there's a prevalence study in Bali and Yogyakarta on this. This is just a sketch. It's part of the advocacy journey that I did in understanding people with dementia at the center. And other partners, if you can look at this, perhaps this is the real, I mean the more clear version. This is like, you know, my brain was just thinking who are other organizations that is involved and all that. And this is the stakeholder mapping. So if you see people with dementia, you know, how does private sector play a role? What does the government? You know, it's not only Ministry of Health, Ministry of Social Welfare play a role there. Ministry of Workforce related to care workers that goes around 250,000 care workers in Taiwan have no clue at all on how to deal with dementia. And we received an invitation to give training in Taiwan to help Indonesian migrant workers. Healthcare from non-pharma and pharmacology and all these agencies, international and NGOs and institutions. Of course, it all started with a problem. There's a problem that we want to solve, and there's a root cause of lack of knowledge and awareness. All my siblings are graduated from University of Indonesia. I mean, we're supposedly fine in education, but nobody knew that mom, welcome Sila, a friend from Sila from WHO. Actually, she's actually one of the volunteer, the first person that I recruited. Thank you for coming. Alzheimer Indonesia. She was working for WHO, and her office is actually just one floor below the Minister of Health. So it's perfect for advocacy because whenever we send a letter to the Minister of Health, I asked her to knock the door of the Minister of Health's office and say, we need a response for this. So you need to be also proactive and know what you want and what to ask. What is the ask? So the root cause is lack of knowledge and awareness from all stakeholders. Root cause 2, the lack of diagnosis, care, and treatment. Related to them. And one of the entry points is actually from issues related to diabetes, hypertension, and all that. And root cause 3 is lack of support and information for caregivers and public in general. So understanding the root of cause will lead you to design the key messages. And when we talk about advocacy, it's from the Latin word advocare. I always always like to say, it sounds like I'm Italiano. Advocare. It's speaking on behalf of someone. So I will forever speak on behalf of my mom, because she plays a very significant role. Because of her, I'm doing this, it's my purpose-driven work, and I apologize to you because I have to leave around 3:15, 3:30. I have other commitment and after this, but I'd like to share this advocacy and partnership lessons learned that we've been going through. So there's a crucial role of non-government organization, together with government, together with private sector and all that, not only speaking on behalf of someone, but also walking together with them. So it's not a command control style, it's really like, you know, togetherness. So from advocare, and there's also fundamentals of advocacy. You need to have a strategy. You need to have data. You know, just start by a simple data of where you live and know how many elderly live there, what's the population and all that. What are the disease, you know, hypertension, diabetes are the highest data in my environment, for instance. The key messages must be simple and clear, and that's why we have the key message of jangan maklum dengan pikun, do not underestimate labor laws. This campaign to build support, I'm lucky because there's no longer Sarah Sehan's show now, but I had the chance of being invited by her in her TV show, and also Kick Andy, maximizing this network of media to spread the word, set realistic demands. So what's your target, and provide solution as well as building coalition network and be present. So this is the elements of advocacy, which is facts, because policymakers need to know the impact of the disease and what you're aiming, what are you aiming, and what's the bigger picture of things. So we have sustainable development goals, we have Nawacitra here in Indonesia, we have, and it's under component 3 of improvement of quality life for all well-being. Spokespeople, the face is important. Champions, all the allies that can be the drivers of your advocacy work. And partnerships is a must. You cannot do things alone. And a call for action. What do you expect? So these are some things to be considered, because sometimes you attend a meeting without knowing what to ask. And this is something that it's a homework that you need to know in advance. Like if you meet a mayor or a governor, you know exactly what to ask and how it linked to their system. I remember during the previous government era, there's this orange troops, there's green troops, you know, and for all these services for the public. And I just simply text and ask the governor, can we have purple troops? And these purple troops' job, we suggest, is to help elderly that's missing and link with the social welfare office. So these are the things, the homework that you can also start to explore when you want to do advocacy. And also have a social marketing mix. You understand the people, and if it's product here means the behavior that you like to target, what kind of behavior change that you're aiming. So from people who don't know, for instance, dementia, we're aiming to have, you know, 1 million people know 3 out of the 10 key messages of dementia, symptoms of dementia. Place where exactly you want to conduct your training or programs and all that. So the promotion, the public. First strength is the funding. You want to make sure that you ask partners to chip in, policy, and definitely partnership. These are the 2 components I'd like to share about building partnership and advocacy. So the component of building partnership, we basically want to see the improvement of how health policies could be turned to real implementation. And this is one of the homework, I think. There's many policies, but whether it's implemented or not, you're questioning it. And that's where civil society play a role in becoming the watchdog, so to speak. So these are how to build partnership, the components that to be focused on. And as I mentioned, because of my mom, in 2013, the notary actually asked us, the founders, to sign the official paper of ALZHEIMER Indonesia, and it's exactly on my mom's birthday, like 3rd August. As if the universe is saying, confirming, this is the mandate to be done, because people don't know about dementia. And it's a 250 million population in Indonesia with 20 million elderly and estimation of 1.2 million people with dementia. And I think this is like the 6th year. We have more than 5,000 volunteers and 21 chapter leaders in 21 cities with no funding in the first 3 years, purely volunteering. And on the 3rd, going to 4th year, we received support from the Ministry of Health Netherlands, not Ministry of Health Indonesia. So Ministry of Health Indonesia, I don't know whether because there's 350 years of colonization in the past, but they have funding to help. And for the 2nd round, they already say, end of this year will be the ending of this funding, and they basically say, we need your government to chip in as well, a matching grant. You know, so we're trying to advocate our government to also chip in on this, which is a challenge. We have around participating people on caregivers meeting in 21 cities, and it's all organic. Like because of the media exposure, people reach out to us through Facebook, through WhatsApp, and say, I want to do caregivers meetings or support group or activities for the elderly. Judy, I asked actually personally to help in talking about nutrition in the ALZHEIMER Indonesia Depok, because she lives in Depok, you know. So yeah, like you maximize your expertise and what you can share in your own neighborhood. And with WhatsApp, everything is really easy. So the vision is to improving quality of life of people with dementia and caregivers in Indonesia, with the tagline of Jangan Maklum dengan Pikun, and we also have tagline Sayang Ortu. You're not cool as a young generation if you don't spend quality time with your parents. And that quality time doesn't have to be physical. It can be over phone, FaceTime, Skype, Zoom call, whatever. You know, like these are the quality time that actually could improve quality life, both you and your parents, and that's the campaign we'd like to explore. And the strategy, again, my friend Tika was also involved in the beginning of this, of the process on what would be the strategy. You want to have the goal. What is it? So we come up with this. This civil society will be the voice, advocare, the voice of people living with dementia, and the caregivers, empowering them with knowledge and providing them with services. So these are the ultimate goal. And the pillars on capacity building, on advocacy, on communication and fundraising and all that, that's the pillars that that help us to reach this goal. So it has to be very clear and with really clear activities that could be measured at the end. I need to share this because this is something that I envisioned in 2013. So advocacy, what is the plan? What is the strategy? So I know if I only focus on national goal, it will be challenging. So we also, together with the ALZI volunteers, say, let's set up a province goal as well. So the goal nationally is to have the Dementia National Plan launched in 2015 and have the National Asia-Pacific Conference in 2017. And in province, have a decree of a dementia-friendly city. Very happy that the decree happened in Balai Kota under the previous governor, with having officially having purple troops as the first ever troops to take care of the elderly and all that. And the 2017, Indonesia hosted the first ever conference on Alzheimer. But the first one is just a bit off because the national plan was finally launched, a delay actually, in 2016. But this was written in 2013, having a clear vision this is the high level advocacy we want, and it has to happen no matter what. And it has to be continuous. You cannot just send a letter without asking, without being actively pushing things to happen. And the goal of behavior change related to awareness raising is the caring for elderly is increased and promoting a healthy lifestyle habit. Because all these things that link to behavior and dementia, for instance, risk reduction, ways to reduce risk of dementia is including consuming vegetable and fruit every day. Who's actually practicing that, applying that? Eating fruit and vegetable? Yes, only one? 50% in the room. I'm concerned. This is a nutrition class, no? So I was expecting people will just raise up fruit and vegetable every day, physical activity 30 minutes a day or 150 minutes a week. Who does that? Oh wow, only 5. Okay. There's a research state that 150 minutes physical activity could reduce risk of dementia and other non-communicable disease. So there is a literature on that. So that's the behavior that we aim on. And in terms of capacity building, again, I look up to the documents from the past. So there's this vision of a health system strengthening program, targeting what does doctor need to do, nurses, caregivers. Doctors need to do diagnosis, detection, screening. There is no medicine, there's no cure for dementia. It can only decline the progressivity. So that's why risk reduction program is important. And nurses have to also support by home care, conducting long-term care and all that. And for caregivers, there's domestic workers type of caregivers, and navigators are the ones that we thought could help. The ex-caregivers or caregivers themselves could help navigate how to journey this journey of caring of dementia. And this is the advocacy that we've done with several high-level government, from the previous Ministry of Health to the governor, the King of Jogja, previous governor, and the governor of Central Java. Just an example of the advocacy we've done. Yesterday, one of our ALZHEIMER Indonesia Bogor conducted advocacy to Bima Arya, the Wali Kota in Bogor. So these are things that we're working on constantly. And this is just an example of partnership that you saw in the video, because CIMB did a color run, and I was expecting there's a purple color, you know, but they have their own set color, so that's something that you cannot advocate. It's already a system, they do the color run everywhere in the region. But CIMB Niaga is now exploring support from supporting Alzheimer Malaysia. So HSBC, the bank, just recently became the first ever dementia-friendly bank in Hong Kong. So we're trying to help HSBC in Indonesia and other countries, and these are partnerships. Meaning, apparently in Hong Kong, there's many people with dementia or elderly that went to the bank and don't know what to sign, and they're being abused by their own family, and their money is gone completely, and all that. And so you cannot underestimate this disease, because it really created so much drama in a family, and I experienced it myself. So these are examples of partnership. For instance, the government, local government of Jakarta gave 30 Videotron space the whole September. And thanks to partnership with private sector, last September, the whole month of September, Bank Central Asia in the Tamrin area also have this video, including all these collaboration with Gramedia, for instance, the first ever book that I wrote with a friend, and seminars and all that. So these are partnerships and collaborations that we work on. As I mentioned earlier, the risk reduction approach is what's good for your heart is good for your brain. 30 minutes a day, physical activity, consume vegetable and fruit every day. You stimulate your brain by, organizing things, or, participate in a gathering, or, all these things related to stimulating the brain to be active constantly, and socializing. So these are things that, that people can do to reduce their risk. This is just a map of the Indonesia chapters, all the activities. There were competitions like cooking competitions, actually, recently in Solo. They are partnering with Transmart. So Transmart in Solo was approached by our team and say, okay, let's do a cooking competition of elderly. And it was a hit, and now we want to take it to the next level on a national level. So these things are done through all these advocacy work. And one of our champions in Netherlands was so lucky because I mentioned to her, Jokowi will be in Den Haag, you know, and she's like, okay, you know, I'm gonna be Jokowi no matter what, you know, because it's so hard. And she had to receive some what do you call it? The bodyguard wasn't too nice to her because he's trying to protect Jokowi, but she was so adamant in getting this photo and having the president was holding the brochure as well. He's just not seen here. But our champion in the Netherlands, she married a Dutch guy and lived in Groningen, which is really far from Den Haag. But 3 hours train, she took that 3 hours train because she knew what to ask and advocating. And now the ambassador of Netherlands, Indonesian ambassador in Den Haag, always supported her with spaces, venues, giving free tables for some seminars and all that. So that's the key of advocacy and partnership. You keep on chasing people, but knowing what you want. And all these things are activities in the Netherlands. They did a Pocho Pocho with 500 people in the Pasaraya event. And this is the National Dementia Plan launch in March, launched finally by the Ministry of Health. And all these activities related to training and the infographic. If you go to alzi.or.id, you'll get this information there. And the brochure of 10 warning signs are also translated to Arabic. Alzheimer Monaco and Morocco asked us to help. And the Alzheimer, the Javanese, Ojoma Klumarang Pikun, it was requested by Suriname. So there's many Javanese people in Suriname. Can you imagine that? Like, not Javanese people ask us, but here in Indonesia, but the ones in Suriname wrote a letter and said, we want to get your brochure. And I'm like, in Indonesia? No, in Javanese. Okay. So that's one of the things why key messages and communication tool is important. And of course, the Netherlands, the Dutch, and the French version. So these are things that you can use. And I was talking about Purple Troops, and also there's an intergeneration home visit. So with partnership, we really we are trying to explore partnerships with other organizations and private sector, because the dream is to be the platform of young people, millennials, to support and contribute their time for the elderly. And some of the young people actually visited the elderly and people with dementia by singing all these old songs. So they have to stimulate their brain in singing Elvis Presley song. You know, they know Justin Timberlake songs, or the Kekinian songs, but they don't know the oldies. So that's also helping the young people to stimulate their brain to avoid getting dementia. And the Purple Troops with the social welfare, they help. And it was, if you Google or YouTube, Al Jazeera actually produced a documentary on Purple Troops, so they call it Purple Squats. And we also had that picture taken with Jarod and the previous governor in front of Monas. It's all in purple the whole month. So, because purple is our branding, that's why I'm wearing purple. And thank you, Judy, who's also wearing purple. I didn't expect you to also, wear that color. But it's a branding that we constantly visibly share. So we're Alzheimer's Indonesia now. The achievement for the past 6 years, we are the ones or organization that always promote the care for elderly, especially people with dementia. We promote healthy lifestyle. We did all these run and fun walk and all that. We advocate to the government to have policies, not only in the national government, but also in Bali and in Jogja. Today, there's a training of Balinese purple troops, as per today, because the governor is actually interested to explore more. And that's something that we are very excited, not only having Jakarta, and Jangan Maklum dengan Tikun tagline, the go-to source of information. So some people go to the doctors but complain because of the long waiting, and people who approach us really want to be navigated on this journey. This is an ideal proposed integrated community care system policy that was discussed in Japan, because Japan is very advanced. So there are the integrated managerial service. So ideally, someone's home is really near where the nursing home is, and there's home care visits and all that, the daycare center. And because, you know, the traffic jam could really affect people with dementia and families. And that's something that we are constantly trying to figure out how we can help. And this is just a framework from WHO and Alzheimer's Disease International. Like in terms of partnerships and places and people and all the resources, you can look at your PDF. But the impact long term is really, really related to establishing a dementia-friendly environment. So dementia-friendly or age-friendly environment is a place that people with dementia are being respected. You know, I still remember when my mom, you know, was so confused in the store. You know, so if it's a dementia-friendly, we need to train the staffs at the store and the police. You know, and to know that these are the symptoms. And it could be also, you know, linked to other organizations or industry. And linked to the nutrition part, we also produce a book with one private sector. And this book is a storytelling for kids, because the kids or the grandchildren notice that the elderly forget their glasses and put it in the fridge, for instance. And young kids are, you know, grandson, granddaughter are also change agents on this. So these are examples of all the partners, local, international stakeholders, from media, private sectors, government as an example, and we maintain relationship with them. And the photo on top is one of our volunteers, Dr. Sophia Hake. She's a sports medicine doctor. And we actually did, and Judy was involved on that as well. We did an hour session in all high school, junior high school, and vocational school, only during the first 3 days of Masa Orientasi Siswa, the first 3 days of school. And the photo on the bottom is the caregivers meeting support group from only 12 people. Now it's spread to 100,000 in 21 chapters. And all the highlights and impact, it should be in the website. So yeah, that's it. Thank you so much. I hope it's useful for your advocacy and partnership in relation to nutrition. I'm happy to answer or have a discussion. Thank you.
Thank you, Diwai. This is the proof, yeah? So, very efficient, 30 minutes sharp. So, I mean, that is probably something we need to also learn, yeah? I mean, if you are given time, 30 minutes, 30 minutes. I'm talking to you.
Pressure is on. Yeah, well, before I would like to open the session, I would like to,
to convey, I witnessed one high-level advocacy that was actually done by Diwai to our director, Pak MM.
Pak Muhtarudin was actually the director of Kesehatan Haji. At that time, he was actually having the 2 hats. And then it was actually by chance that she was going to teach here, and then I introduced her to Pak Muhtar, knowing that Pak Muhtar is from that Haji, Kesehatan Haji. What she did was, she opened up her laptop and then giving like some kind of a quick information about what is Alzheimer and what Alzheimer has been doing, Alzheimer has been doing, and then basically trying to follow up with follow-up meeting, something like that. And then she actually won that particular pitch in, talking with that very narrow,
elevated pitch, yeah, because there is an insider. Yeah. So, which is also interesting, and then I admire actually the pace that was. I don't know. I was going to ask actually this question: is it bakat-bakatan to have that kind of, I don't know, passion, so that you are able to talk to the right people with the right tone, with the right message, and you get the right outcome you would like to get? So maybe you can answer that later. But then I would like to invite now the audience, if you have some questions you would like to address to DY. If not, you can email her.
So adding of the Pak Muhtar, we produced the Hajj version of the 10 signs, and it specifically have illustration of Haji, because 70% of the Hajj from Indonesia are 60 years old, about. And they sometimes got lost in Medina or Mecca. So we did a... Huh? Yeah, which gate? You know, very confused. So this is just an example of that elevator pitch led us to having this support. I can share this. Of getting support, and it's all printed by Ministry of Health.
Yeah. Okay, questions? Anything you would like to address?
They're all clear.
You cannot clone DY actually. Bakat-bakatan. Keep that question. Yeah.
I can answer that. I think I'm according to Myers-Briggs, I think I'm the extrovert, and Tika is actually an introvert. But she also have the capacity and ability to do that elevator pitch, as long as you're clear with the key message and what you want out of, and you just train yourself, you know, like, so the backup is, you know, if you're passionate and you believe on something and you want something to happen so bad, even though you're an introvert or you don't feel comfortable talking, you can actually train yourself on that, in my opinion.
For the Komunitas group, yeah, you have that experience the other day, elevator VIP talk, we call it, for 20 seconds, yeah? Okay, introduce yourself and then please be direct on the question. Thank you.
Okay, thank you. I'm Retno from Women Nutrition Student. My question is about what is your entry point to make an advocation to the governor, or like,
and also in the private sector, and what is your, what do you tell to them or offer to them so they can like give the bigger support for your activity? Thank you.
Thank you. Very good question. The first thing is you need to also have a mental state that you're not lower than them. It's equal. Like, I offer you something, you need something from me. Like, you will benefit from me as well. So the entry point is basically, you know for sure as well that this is what you offer will benefit them, and it linked to their KPI, you know, key performance indicators. That's why you need to do your homework. What is the benefit of this to their RPJM, yeah, those APBN, APBD, and all those things, they need to, so the entry point with the governor, with the minister, and I mentioned to you, I was lucky that Sila was working in the same building as the Minister of Health. So I asked her, what is the direct email address of the Ministry of Health? Because it will take forever if you go through the normal route. Yes? And not taking no for an answer. So I didn't have any access to the governor. I did not know him at all. It was during Jokowi actually, when Jokowi was the governor. But I literally just tried to find, you know, what's the phone number of the Biro Umum, you know, all the people, and then finally got the direct email address and direct person who's dealing with the letters, who's dealing with the one who assigned. There's always people who assign people's timeline in this high level. So you need to be friends with them, you know, because they're the one who, adjutant, you know. So adjutant, you get the adjutant's number. It's actually good for you to have coffee with them, you know, and then hang out or talk to them and all that, and link. Because again, like this issue is related, everybody have parents, you know. So it's something that we link to their own personal, emotional part of it. But the entry point, simply not accepting cold calls, not accepting, oh, just leave it at the desk and all that. No, you want to make sure who are the person, the direct person who's in charge of this. So it varies. With Ganjar Pranowo in Central Java, our entry point was AJI, Aliansi Jurnalis Independent, because they're very close and they have regular meeting with the ministry. I mentioned Lucila, thank you. With private sector, there's some private sectors of friends of so-and-so. You see LinkedIn, you know, people are connected, who knows who and all that. You just do your homework on that. So yeah, I hope that answered your question. Yeah.
Thank you. We have Jess. Oh, yes.
Yeah, thank you very much
You.
for that very inspiring and informative talk.
Thank you.
Just a follow-up question to her question is like, well, as the lead person, you do this kind of initiative work for key persons, like. But I noticed that you have a lot of teams all over the country. So how do you approve the formation of such teams? So how do you select the champions in all these areas, and how do you sustain that? Because like the follow-up definitely will not be coming all from your side.
No.
So how do you now make all these things work together?
Oh, very, very good question. This is a
Question that's related to reality as well. And there's,
we call it drivers and passengers. So you know, the champions are drivers. Drivers are the one who have this initiative, and we provide them with the brochure, with the standing banner, no amount of funding, but we link them up to Prodia, private sector, and all these partners, and then give them the standardized what to do. And we have WhatsApp group, so we monitor them. And out of the 21 chapters, because of this WhatsApp group, they got so competitive. I got this, meeting with the vice mayor, and we did this cooking, and then Semarang was like really excited about it, and contacted me and say, how did you get a solo to get this transport? And I'm like, no, it's through, we just give it to you. You got the access as well. so it's through, I think that's like a screening. So these screenings are done through, and these people, one of the key elements is we have a profile of certain people who are drivers. And the non-drivers will fade. They will just be passengers, and they will just contribute at their pace. But the drivers are there forever because their mother-in-law has dementia, and these drivers actually, for instance, are active in churches. So they do these sessions in churches. And some drivers are active in the elderly community. And we provide them recognition through media. So, for instance, Andy Noya is a friend of mine, Kick Andy, invited one of this chapter to the TV show, and they get so much exposure and recognition and all that. So it's really organic, and it's not like the typical people who got assigned by their boss to attend something and then they disappear. No. This is what we love about this community. And whenever we have rituals of annual meeting, it's the same person with another junior of them that recruitment. And now that's why we need more funding and support and all that from local government. But I understand what you're saying. It's not easy if you don't really recruit the right people that share similar drive. Yeah. Thank you.
Okay, one more question if you still have.
Okay, maybe they are still digesting. I think a lot to take in. We need more stimulation. I think you may be seated, DY, so I think you still have time to also listen to the rest of the seminar. And the next speaker I would like to invite Rigil Munajat Cinta, I call it, who is also the best singer in Senior building. So Also, I would like to invite you to introduce yourself
and then tell us your hobby, things like that, before you talk about your program. Yeah. Okay. Also 30 minutes for your presentation. Thank you. Thank you.
Thank you, Mbak Yudit. Now I feel more under pressure because of things that need to be clarified. But yeah, my name is Emil. I am project manager from Fit for School program in Indonesia. And then later on we will talk more about the program. And actually, I got this job from Tika. So it's like 7 years ago, yeah, 2012. And this is one of the institutions that I've been working for so long. Before I worked with NGOs, and it's mostly like 3 years or 2 years program, but now it's because it's G2G, it's more long-term partnership with the government. So yeah, I don't know, this is not a German thing, but I work with German, so I need somehow to be, remember on what I need to. Am I changing? So yeah, just to make sure that I don't miss any important points that I want to share. So yeah, does anybody know about GIZ before? Yeah, maybe for one, but it's like I mentioned, it's people. Some people call it NGO, but we actually not an NGO because we are more into government partnership. So it's many people asking for what is GIZ stands for, and then actually Jerman itu sulit karena memang with all the regulation, with all the procedures, yeah, we call it sulit, but yeah, it stands for like German Cooperation Development, Deutsch Gesellschaft für internationale Zusammenarbeit. Yeah, so in Indonesia itself, we work almost in all ministry, supporting them from KBK to forestry, climate change, and this Fit for School program is under education sector. So this is a very simple program. You may see later. It's also fun because it's we meet with the learners, the pupils, doing hand washing, toothbrushing, deworming, not singing. Yeah. Okay. Okay, what Fit for School and so this is our third phase from the usually in GIZ we don't have a program that more than 10 years, so it's already started since 2012 in Indonesia. So this is it will be our last phase, and then related more into water sanitation, we call it WINS, water sanitation and hygiene in schools. WINS, yeah. It is very simple and modular, based on evidence-based, very cost-effective, and somehow when I try to introduce it to the government of Indonesia, they say, basi. Hand washing, brushing, boring, yeah. Yeah, something like that. But what the difference is, because we want to answer the gap between the policy and the implementation. Because usually, what kind of policy that we don't have in Indonesia? We have all. From everything. Yeah, but when it comes to implementation, then yeah. So we try to fill in the gap by not only saying it, but doing it, something like that. So it's also close interaction, science, research, and practice, supported by GIZ. And at the very beginning, it's actually about the oral health. Because it's also invented by the dentist. Yeah, realizing that back then in Philippines, if I'm not mistaken. And then every day, children are coming to get a treatment. And then the rate of toothache is very high, and then she's become very tired, and then it should be not during the treatment, but think about how can we prevent the oral health problems. Why school health? I think you already know that most of the population is at the school age children, and then more than 50% also live below the poverty line. And school offers the best chance to reach these children. We don't have like Posyandu to calling all the moms coming, but at school, yeah, we just need to come to school and we can get all the participants. Yeah. Okay. And then, yeah, this is also the reason why we choose school as a pattern to do the health promotion. Reaching children easily, receptive age for behavior change, will give high impact on health and development, high evidence for preventions, very cost effective, essential improvements in water and sanitation, because somehow when we try to do this program, the school itself will provide not only the activity but also the facility and infrastructure. Okay, this is also the condition that children always have a problem with diarrhea, intestinal parasite, and also dental caries. That's why we come up with those three approaches, like doing daily hand washing, toothbrushing, and biannual deworming. And then these diseases are preventable at low cost. And I don't know, but until now, in the healthy hygiene concept, like PHBS, perilaku hidup bersih, hand washing always mentioned, yeah, but not toothbrushing. While actually, the reality, 9 out of 10 have dental caries problem. So it's a problem, but to neglect about it, yeah. And then, yeah, addressing the social determinants of health through schools. We know that even now, kids are spend more time in schools from 7 to, I don't know, I think 3 p.m. Yang ngalahin yang S2 ya. Karena ini tugas buat besok. Yeah, so creating healthy school environment creates also healthy children. So by just providing a healthy environment in school level, somehow we also contribute to give the opportunity of children to be healthy. And also, school acts an equalizer. We don't really care about the background, whether it's from rich, poor. Yeah, it's very a perfect place to do the health promotion things. So this is the evidence-based intervention. Yeah, like I said, when I try to speak about it to government, and it will be very boring to them, but that's why. So this is the tips and trick. We need to speak their language. We need to see who is audience. Like if we talk to Department of Education, we cannot mention 90% in this area is having diarrhea. They don't care, but okay, so what? Yeah, but when we talk about this is something that can contribute to character building. That is my goal. Yeah. And then talking about school, it's not only under the Ministry of Education, right? It's also under Ministry of Religious Affairs, because we have madrasah. So that's why when we should try to speak kebersihan sebagian daripada iman. you. Is it really happening in madrasah school? Yeah, so yeah, we need. This is also a challenge. At the first time, we want to get a buy-in from the government. So that's what I find. We need to speak their language. So we need to know our audience, then start to use keywords. What will be their benefit if they want to adopt this approach? Okay, it looks very simple, but when you get into details, it's not that simple. Have you washed your hand before you eating? Or after using the latrine, the toilet? Yeah. Well, people say that we are what we preach, yeah, but that's the hard things. But what I want to explain on this slide, because it won't running well if there is no management. So what I try to mention here is about the school-based management. So if you already have the facility, but you don't have the activity, would it give any impact? If you have the activity, but you don't have the facility, how come you can do it? If you have the facility and you have the activity, but you don't have the materials, which is somehow need to be put in your school implementation plan. That's why we call it school-based management. So you have the hand washing facility, you have the activity, toothbrushing and hand washing, but you don't have the soap, you don't have the toothbrush, and you don't call the puskesmas to provide you with the warming towel. So this is like a three main pillars that needs to be happening in school level. It's not only the facility, but also the activity, the healthy hygiene habit. We call it like pembiasaan, and then also the management. So yeah, and school always have excuses. What is because I spent like 6 years working in West Java, and then at first I'm always trying to understand about their job. There is always two things become a main problem. Here, what is that? It's Mang Dana dan Biaya. Dan Biaya. Iya.
Okay. Pak Jess is now puzzled. Translation.
Mamang is like an uncle, yeah. Bibi is like an aunt. Mang Dana is mean like funds, financial. Always first, what comes in their mind is financial problems. I don't have the funds. It's Mang Dana dan Biaya. Paling ngetop si Mamang dan Bibi itu tuh. Di sepanjangnya di Jawa Barat tuh. Padahal actually it's not about the financing. It's more about whether you want to do it or not. But if you go to school, it always be first excuse that they need. And I also work with Tika because after I tried to build the facility in model schools, they're not even using it. So we tried to conduct an implementers forum, yeah, you remember, and then try to find out why. There's also things that happen in the field. So maybe this is not very important. I already mentioned that the background of this program is basically oral health, but now it's growing into wash sanitation in schools. Yeah, so it's specifically not only about hand washing, toothbrushing, but also bringing your own bottle, and also bringing your own sudah nama misting. No, bringing your own. Yeah, bringing your own lunchbox, so it's to reduce for not using plastic. Yeah, so yeah, you know, there's also a question. This is also my question: why, when it comes to providing meals to kids, it should be something that prepared at home, not something really given from the government, because it won't last forever. Yeah, so this is it's actually a regional program. It's not only implemented in Indonesia, but also now in Cambodia, Laos, and Philippines. And from these 4 countries, which one do you think give best performance? Philippines. Well, let's not put Philippines, because Philippines it's like an example, yeah. In the very beginning, we start with Philippines. So let's reduce it into Philippines, Laos, and Cambodia. Indonesia, Laos, Cambodia. Yang pasti bukan Indonesia pemenangnya. Ya, karena because we have each issue with being istiqomah. We are more into like panas-panas tai ayam. Jadi, yeah, I don't know how I should call it in English, but we are tend to only interested in sporadic, sporadic activities. So that's the issue. So when I try to implement it until now, like in every country, they already did it every day in each classroom. In Indonesia, they say, yeah, we did it Monday for first grade, Tuesday for the second grade, Wednesday for the third grade. So it's not for all grade. Yeah. So because they are too much focusing in financing, build something, but not really into doing the activity, while actually it should be balanced. Yeah, and here we are providing only technical assistance to our government, so we are not donor agency. We don't come up with funds or money, but we are more into giving technical assistance to our government from national level, provincial, until to the grassroots level, school level. Yeah, and maybe the heart of the presentation is on this slide, because this is our approach. Before it's like only 3S, but we come up with 4S now. I don't know, after this year maybe 5S. It's simple, scalable, sustainable, and system-oriented. So every time I think it's not only can be adapted in Watson program, but also for others. Like we really need to think, if we want to have it scale up, then it should be very simple, and also use what we already have. We don't always have to reinvent the wheel. We just use what is there, and then maybe try to revitalize or strengthen what's been there, because Indonesia is not. We always tend to comes up with give me the ideas or what's new, but actually, yeah, it's also for our government. Every time we change the high official, there's always also changing with the program. Yeah, so yeah, sustainable, simple, scalable. Then this is also a challenge to somehow translate it to our partners, because when we speak up about scalable, they always, oh, so when will GIZ add more schools, add more, spread out more, while actually scaling up, it should come from the government. So this is a very cliche issue, sustainability, but we don't really even try to start to solve it. And then what I see from the previous presenter, that the very foundation is monitoring and evaluation. And FYI, this is not our culture. Agree? Yeah, well that's the problem. And about the data, satu nusa, satu bangsa, satu bahasa, belum satu data. Yeah, I know at the Department of Education here in Bandung. How many schools do you have in Bandung? 340 something. Oh, okay then. And I go to health department because they have puskesmas, right? How many schools that you covered? We have like 360. Rumah dari mana tuh 20 kan? Jadi belum satu data. Even now we have the Dapodik. It's still in process, yeah. That's why later perhaps we will take course in Laos, not in Indonesia. But I think yeah, a few years ago they conduct like school health nutrition, just the course in. Okay, this is also continuous learning, so this is also an issue. When we work with government, we need to keep up the momentum. Yeah. Jangan kasih. So this is like an example because back then I was still working with the famous Ridwan Kamil. Yeah, and then he only gave us like 10 minutes to present something to him, and then why Bandung need to adopt this approach. So yeah, 10 minutes. So we try to, okay, when we talk to high official, it's always about numbers. We should give information how much money that the city need to spend if they want to invest something on the program. So comes up with numbers. And then don't talk only with the high official. When you, I don't know whether it's part of advocacy strategy or not, but maybe only with the high official, we don't have any guarantee that the ball will rolling. So make sure back then we invite Ridwan Kamil and also the head department that related to school health programs, Disdik, Dinkes, Kemenak, and then Kesra. Make sure that the head of that head there, so he can directly pointing finger that what kind of action that need to take after that. So yeah, we also so after that he agreed to adopt. So from 6 schools somehow to 100 schools and now to all schools. Back then, after we have a meeting with him, then we somehow try to lock the promises that he made in international event the year after in Bangkok. He said, yeah, we support, okay. And then after that, we said to him that, oh, because you mentioned about that you will improve here, there, so the participant want to learn something. What about if we do the international learning exchange and pick Bandung as, yeah, mau nggak mau kan? So we keep the momentum. And then after that, being selected to be as an example, now he ran for the. Yeah, but what is good condition in Bandung, because now the mayor is previously the vice mayor, so we just continue. Okay, so it's to keep the momentum. Also comes up with a scaling up process. This is also, I think, one approach that I need to share, because in GIZ we have to wear many caps. So by that means, like kalau misalkan if we conduct an event, ya lu yang buat standar, yang lu buat presentasi, yang lu ntar bikin reportnya one man show. We don't have a lot of human resource in GIZ. Sama ya? Same. So we think that if we take the training approach like doing a TOT, it's very cost effective. We are very have limited resources back then, so we comes up with the idea we need to have something like a manual that can be used as a self-training. Only by having that tool, they can receive information and also learn something from it. So we try to make manuals also contain with video, so if they don't understand what's inside, then they can also watch the video. So I think back then the process also supported by Mbak Ika. Yeah, so we comes up with manuals. Now it's we have the ministry logo, Kemendikbud right now. Okay, because yeah, the last 3 slides is more into our idea of having a washing facility, because here's the thing, if you try to promote hand washing to school to be implemented for all students in school, and you just have individual hand washing, it won't cover for all. So we comes up, it needs to be a mass hand washing facility. Something like ya, untuk tempat wudhu mungkin ya, misalkan di ya ini. Well, it's also a challenge to come up with the idea, because I don't know, for Indonesian people, we are tend to only look at the beauty side, not the function side. Yeah, that's why we have a problem. But when we already built the facility, it's no water, it's not being used. So yeah, this is the idea that this is an example for a school that have many excuses, that we don't have space, we don't have people to build it, or we don't have time to do it. So this is a very simple, only with punch pipe, not with faucet, because in Indonesia everything will be gone if there is no satpam. Yeah. Better to use punch pipe because it's more cheap and also durable, not risky. Yeah. Okay, so this is the paper school best features that I can share. It's evidence-based. I always remember my supervisor word, no. Yeah, like to see is to believe. Kalau nggak lihat, nggak bakal percaya gitu. That's why, yeah, to see is to believe. That's why we one of the project we try to do is learning exchange, to get people coming and see. So this is actually happening. This is actually can be done, something like that. So the 4S principle: simple, scalable, sustainable, and also system-oriented. School leadership and management is key for success. Continuous learning, and then we now GIZ is doing collaboration with Rec1, so we are not only focusing in wings anymore, but also the nutrition. So maybe this is also a big issue that somehow sanitation contribute to the prevalence of stunting. Is it true? The expertise. Yeah. So now we are planning to have like three years collaboration with Rec1 to work hand in hand together. So nutrition and also sanitation for achievement, something like that. So yeah, and if you need more information about the research, it's there. If you're interested in like the oral health research, it can be found in our website, fitforschool.international. Yeah. Okay, I think that's all.
on with Tika's material, and then after that we will have a Q&A. Yeah, okay.
Again, introduce yourself. Not the choir part, yeah?
Good afternoon, everybody. Still awake? Alive and well? Breathing, hopefully. I know this is a very hard time to be learning anything. At this hour, our stomach is probably doing all the work and not up here. So there are a couple of things that I would like to maybe start off with. I noticed that in the poster it said health promotion, correct? But we haven't really done our work in terms of defining what that is, at least for this particular conversation. And if you can see, I'm not very formal. I tend to thrive more in a discussion manner, so I would like to ask for your help in this particular session. I would give out this post-it notes. Just take 2 each, and then write down, just take one and like give it to other. And take one and like write down what you think is health promotion. There's no right and wrong. Nobody knows that it's going to be you writing it down. I'm not going to judge you, give you A or D on this. So just write it down because I need to know what you think it is. Now, while you're doing that, I'm just going to share a little bit about what to expect from this presentation. I know that once you do a presentation in a very excellent education institution such as Samuel Rekvon, then people expect you to be very scientific and very formal and very wise and evidence-based. That is not what you're going to get from my presentation. Because I would like to do several things. There's not going to be any quick answer from this presentation. That's one, so don't expect it. The second one would be, there will be more questions because it's a discussion and we're trying to get the answers together. And the last one is, we may have several good ideas to move forward. And this is the things that I would like to pitch to you and convince you that you might want to try when you delve further into this particular field. As you can see, I'm very passionate about this particular field. My name is Tika Wulandari. People call me Tika because I just don't like using my first name because it creates a very high expectation. So I just go by the name Tika. Because as Tika, you know, you expect somebody coming out of a beauty salon. You know, maybe some Botox, skin lift, or whatever, which I'm not. So my background is actually in communication. But then I happen to marry a doctor and we are missing the pillow talk. Like we have nothing in common in terms of, you know, field of study. So I was like, maybe I could study medicine. But that's too late. Okay, I don't want to spend 6 more years studying on a field that I completely don't understand. So where is that, you know, middle ground? Is public health. So I started learning health promotion. And then I got it, you know, I have a job that actually works in that particular field, and I was just hooked. I'm hooked because of several things that I will pass on to you. So everybody has health, what is health promotion? Kind of. Just write it down, it's fine. I'm not going to test you on this. I'm just going to get like a quick peek on what... It's okay. If you don't remember, it's okay. Do you know why I was asking this question? Because while I was writing this presentation, I was struggling with it. So you are not alone. I'm going to sing now. You are not alone. Yes, high five there. Thank you. What is health promotion? And I have 2 answers for that. The short one and the long one. The short one would be, I don't know. Personally, I don't know anymore because there's just so many versions of it. So many paradigms, so many new methods, so many definitions that I am, as a person who's working in the field, I myself is struggling with the definition. So I try to go back to what is the basic. I start with the four critical questions that I would like to pose in this particular presentation. First of all, what is health promotion? Second, how has it been implemented? Because the title of my session is Implementation in the Real World. And then, is it the best way to get the result? Are we doing it correctly? And by correctly, I would also revisit that question. And the last one, what can we do better? There's always intriguing. Even if we miss, even if we fail at something, the next question would be, how can we do it better? Otherwise, the failure will mean nothing. So always ask that question. And I'm going to ask that question here as well. So, what is health promotion? I don't need to see your names, just just stick your sticky notes up my arm. Just stick it. Just stick. Stick. Huh? Stick. Stick. I'm not looking, people. It's okay. Thank you. It's like this is very convenient sampling. I'm sorry. Not academically. Anybody else has paper? It's okay. Just give it. I'm just going to have like a quick read. Thank you. So, by the way, this is facilitating. Just facilitation skill. People. Okay. And this is like, no, it's okay. I'm just trying to scramble it for your perception. Okay, health promotion. Enabling people to gain control of the determinant of health. This is from the Untitled Chapter. You are reading your manual cover to cover, people. Okay. Or giving education to do exercise, education and facilities for workers to do exercise regularly. Okay, so I'm just going to randomly promote about health to public, individual, or community. Maybe you should get another one. Usually, if I'm doing the actual facilitation, that would be my qualitative research. Health promotion. Enabling process to make individuals have more control over determinants of health issues. Oh my God. All of you get A's for your health promotion. That's correct, because when I was struggling with it, I've been doing a lot of things in the field of health promotion, health communication, behavior change communication, social behavior change communication, you name it. Every time I apply for a job, consultancy job usually, I have to change my job title in accordance to the paradigm that is actually consistent with the organization that puts it out. So it's certainly, UNICEF would go for social and behavior change communication. And then if you work for maybe Ministry of Health, then health promotion specialist. And then other would be like behavior change communication specialist, change communication. So a lot of it is very institution-based. And there's a lot of buzzwords. You know what I mean? Buzzwords. Because this particular field is driven by communication people. And communication people have the strength in marketing, branding. So a lot of people comes up with a lot of things all the time. But don't get lost. That's what I'm saying. That's what I'm saying. So when I was lost, I go back to this Ottawa Charter. It's very long, and I have problems with it as well. But it's a good place to start because, 1986, a lot of people agreed to it. But I would like to highlight one part that I want to challenge a little bit. And I would challenge it in this presentation. The bold part says, health promotion, the process of enabling people to increase control over and to improve their health. So the assumption would be that people actually have control. Correct? Just park that thought, and we will revisit while we're doing and examining the latest trends in health communication, health promotion. Okay? So, control. Is that really a thing? So if we look at Ottawa Charter, you should memorize this. You should know this because your definition was already on point. So 5 key actions, what is it? Policy. Supporting environment. You can just read it.
You got all A's.
Yay! So building healthy public policy. Public policy relates to advocacy. That's what they're doing. A lot of it is advocacy work. Creating supportive environments. That means you're designing the environment in a way that is that will enable people to do better decisions in health. Reorienting health services, making sure that when people need it, there is a service to actually fulfill that need. And then developing personal skills. There's a lot of the times that you have to do counseling. You know, it's on the individual level. You want this person to be able to make better decisions. That's the personal skills. And then the strengthening community actions. So there are all those 5 things. And actually when you see it that way, you kind of figure out, so where is the change and the communication and all the things that you usually relate to doing health promotion? Kind of. It's in all of them. All of them needs communication. So sometimes when people come up to me, okay, what do you do exactly? Behavior change communication. And they go, depending on where they work, they go, oh, what is that again? Or, oh, okay, because not many people are actually doing it. You just see 3 people out of maybe 5. There's 4 with Sila, so we just have to find another one outside. There's not a lot of people who are implementing this particular field of work. So, what are the trends now? Judy was asking me, like, what do you want to talk about? And I was like, I want to examine what is out there. Because when you study something, you usually study it from books. You don't study about what's going on. And the book is almost always late. So you should expect that. Like, and as a student, I would really encourage you to try to have a critical review of the trend, what is out there, what is the actual things that is happening, and then cross-check it with your books and figure out whether it's actually still relevant and consistent. We are going to see a couple of things that is interesting. Anybody has seen this? Stunting PSA? So, okay. You have? Well, it's actually, I think it's aired in 2017. It was developed by MCA Indonesia. And I think for a year it was, well, not full year, but like it ran for quite a couple of months, quite intensively. So let's see what they're saying. I don't know how to play this. Yeah, you have to go out and then click it.
Numpang jambannya kali aja. Kali. Gak sayang sama keluarganya.
Bikin jamban kan gak mahal. Gak pakai jamban. Gak jamban. Buruan buat dan pakai jamban sendiri.
Udah cuci tangan pakai sabun.
Okay, so That's a 15-second advertising, public service announcement. I see lost face.
Lost in space.
Lost in space. Lost in translation. Do you know what it's about? Okay, what is it about? I see like you nodding confidently.
Yeah, yes. It's like introducing people at the village that doesn't have toilet, and then they introduce that this is the healthy way to
It's a healthy way to poop, people. It's a 15-second advertising on the use of toilet and sanitation. You're correct. They're trying to basically promote pooping better. Yeah, better pooping. It's okay. It's a technical term. But it's actually a part of a bigger campaign to prevent stunting. Only one part. The other part is this.
Kali aja. Dikali. Gak sayang sama keluarga.
Next, yes. It's like.
Bunda, mau kamu sehat, bergizi baik, dan pintar. Bisa nggak ya?
Pasti bisa. Kan ada ayah.
Kan ada nenek. Kan ada Bu Bidan.
Kan ada saya.
Ayo, dukung ibu mencegah anak dari kekurangan gizi menaun atau stunting yang menghambat perkembangan otak dan tumbuh kembang anak.
Tenang Bu, kan ada kita semua. Cegah kekerdilan, ini penting.
Okay, now I'm going to check. What's the key message of the PSA? Key message. Key message is the Vice President's face. What is the key message? What are they trying to convey? Supporting pregnant women. Anybody else?
I want.
Yes.
It's like it takes a village to prevent stunting.
It takes a village to prevent stunting. That is the concept. And I actually discussed this with the person who actually developed this PSA. That's the concept they're trying to get. Now, my critical question would be, imagine you are a mother and you have a child, an infant, basically, and you're trying to breastfeed maybe. Like, try to really think and place yourself in their shoes.
What would you think as a mother seeing that kind of PSA? Because this exercise is really important if you want to work in the health promotion. Yes.
I see that as the mother can see that she can get a lot of support from the environment to have a healthy.
Yep.
So this works in the emotional level. So mothers are feeling that they are supported. My second question would be, after you feel supported, would you know how to actually do it? Does that make your job easier as a mother?
Just knowing that they are around. That's it.
Just knowing that they are around.
Because I recently saw an interesting Facebook discussion about this subject, and I completely agree with the critical question that was posed in there. And a lot of people, well, not a lot of people, but like a fellow health promotion practitioner asked the question, at the mother level, at the public level, do they need to know the details of stunting? Do they need to understand the concept? And I would like to pose that question to you because it's an interesting, critical question. It's really important for health promotion and nutrition promotion, especially. Do you need to explain stunting to mothers? Why? Okay, they don't know what stunting is. If they don't know, but they know breastfeeding, and they're aiming for the breastfeeding, would they need to know stunting? They need to know? It's like actually, I'm like, this is not the right or wrong answer. Do you want to answer that? They need to know? No, it's not.
Yes.
They need.
Yes,
What-
they need to know.
And the argument would be?
Because sometimes only breast milk is not enough to prevent something.
Okay. So my next question would be, to prevent stunting, what does the mother need to do? These are nutrition students. So you should know this better than I do. So what does a mother need to do to prevent stunting? I'm not asking about the biological prerequisite for the baby. I'm asking on the behavioral level, what does a mother need to do to prevent stunting in her kid? Yes?
Since the stunting problem is not just for children, and the children
Take all the foods that they eat is from mother. So mother need to know that he must consume nutritious food. So it is the point it will be.
Okay. So you're saying because stunting requires the mother to eat healthily, she needs to know about the stunting. But the thing is, the thing that I'm asking is this. Stunting, the prerequisite to prevent stunting involves a lot of behavior, a lot. It's very overwhelming to the mother if you step into their shoes and try to think like a mother. So if you're from a middle-class mother, maybe you have the facilities to do it. You have all the resources and you have all the things that you need to make sure that the child will be healthy. But if you are from the poor class and you just see this, you don't know how to access health information. You don't know how to access health services. You don't know where to get help. Do you think this kind of information is enough? That's the thing. I think a lot of people is stuck thinking about the messages. What do you want to say to mother? You want to promote to mother? And you forgot that in order for somebody to be able to do what they are required, you have to make sure that the services is there, the enabling factors is there. If you pee in the toilet and there is a sign saying, don't throw the tissue in the toilet bowl, and you want to comply with that, but you don't find a trash can, what do you do? Put it in the bowl. This is the missing part of health promotion. I'm not saying you, we often do not empathize enough with the target audience that we are trying to persuade to change. We don't put ourselves in their shoes. We don't think about all the hurdles that she needs to overcome to be able to do what is requested in that kind of ad. And a lot of health communication people just like throw PSAs in the air, get the money out, we have a budget for it, but don't really think about what it does to the health system. So we need to think more strategically in that way. Now, let's look at the international trend. Like, how do people actually do health promotion outside of Indonesia? It's very interesting. What they're doing, they don't say anything. They don't lecture you with how physical activity will prevent all diseases in your life. No.
They just provide the environment. And people naturally choose better because of it. So that is mostly back to the question of control that we're talking about in the Ottawa Charter. And I know it seems like very, very, I don't know, who am I to actually pose a critical question to this age-old definition of health promotion, but I think it is an important question to be asked. Can we actually provide an environment where people are persuaded to do better things without exerting control over them? That is actually the trend nowadays. And we'll see one that the next one is actually talking about nutrition. So this is up your alley. Next one.
So something is wrong with the file. Anyway, so this project is trying to get you to eat more apples. So the first case, they put the cake and the apple, one piece of apple, and so it's side by side. So people usually take the cake, they don't take the apple. So the first time, the cake wins really far ahead over the apple. In the next scenario, they cut the cake, just half, and then they cut the apples into like smaller pieces and put it in a bowl. So you don't really see like one apple, you see like slices of them. And doing that alone increase the consumption of apples with almost 40%. Just by cutting the cake and slicing the apples. Why? Can you relate what happened? Why people behave that way? Because the size, if you take one apple, you're always going to be like, can I finish it? Can I not? You know, so if people are challenged to actually take a whole apple, they're like, I don't want to waste it. It's a question of food wasting as well, especially in Indonesia. And if you can take several slices,
you may take the whole apple with you if you want to, but it seems to be more manageable in terms of portion. So another case study is being done in the US with school days feeding. Well, not feeding, they call it canteen over there. They just rearrange the food and put it in an eye level, you know, promote certain things, the way things are done in supermarket, but for food in the schools. And that can already alter what kind of healthy food is being consumed by the children. So you can make these changes even without the lecture, the information, the counseling, and all those heavy, information-driven intervention programs. That's why I would like to, again, make a critical question. Can we do this kind of approach for several things? Maybe not all. You know, a lot of health decisions need to be done through counseling, but like for other things, can we make people wash their hands? You know, because I think in London School of Hygiene and Tropical Medicine is already trying the nudge theory. Have you ever heard the term nudge? Nudging. Nudging is actually trying to influence your behavior with just small cues that usually is subconscious. So a case of nudging would be painting your toilet to have a clear track from the chambers to the washing area. That's a nudge. You don't even think about it. You don't say, hand washing will make you healthy, where have you washed your hands today, or whatever it is. They just paint green, bright color from the door to your washing facilities. And then when you're there, and unfortunately I didn't download the video, there's also a system of lighting that can be used when you step out of the chamber. There's a sensor, you know, noticing that you're out. A light would blink on top of the water faucet. You come there, water faucet, and then there is a drying area, and the light would be blinking there once you wash your hands. Yes, people, it's that advanced nowadays. So if we're still thinking about what to say, how these healthy things, we are slightly on the old side of things. So we need to be more creative in terms of how we do health promotion. Now, this last one is a little bit lengthy. And maybe I'm going to cut it, but it's really important because this is the latest trend in health promotion, nutrition promotion, health communication, social behavior change communication, you name it. Everybody's doing this, and I will play the video a little bit and then explain to you later.
What is human-centered design, and why does it matter? Also known as design thinking and user-centered design, human-centered design puts people at the core of its products and programs. It's about designing with, and not just for the end user, aiming to truly meet the needs of the beneficiary, customer, or client. just another buzzword? Let's break down exactly what human-centered design is and why it matters for the global development community. Human-centered design has its origins in the private sector, in fields like user interface design and human-computer interaction. While the development community has long recognized the need for more participatory approaches, the sector still receives criticism for design. But what does it mean to design for people? Before creating a solution, development professionals must thoroughly understand the problem by engaging with communities and individuals, spending time with them, listening to their concerns, and understanding the specifics of their lives. This process involves a rigorous collection of qualitative data, which is turned into deep insights about a target audience, and then is used to design a set of workable, personalized, data-driven, inherently context.
Okay, I'm just going to cut there. Did you get what it is saying, or is it too fast? So, a little bit too fast maybe. So, human-centered design is the latest paradigms that is being used in health promotion. And it is a buzzword, meaning everybody wants to use it, it's trendy now, everybody wants to understand it, and they want to say that they're capable of using that kind of approach. Unfortunately, not all of the people using HDCD actually understands what it stands for. So basically, human-centered design is an approach driven by IT and apps developers. So they design computer interface, apps interface, based on how people are using their gadget. So they do a rigorous research first about how people, get the information they want, how people search, what kind of things they need, and then they design the interface and then test them. So testing is a really big thing in human-centered design. Now, you may ask, so what's the difference between the regular planning and the human-centered design? I personally have done kind of both approaches. In the regular planning, you are expected to, well, sometimes you have to skip the research, the formative research in the front. Everybody don't want to spend their money in research. So you are forced to design without data, hoping that somehow your blind throw will hit the mark, like a small mark 10 meters away. That. Now, human-centered design is actually driven by research at the forefront. You have to do research, you have to understand the target audience, who are you are trying to influence, and then you design a prototype. People don't expect you to get it right the first time. You have a prototype, and then you try it. If it doesn't work, iteration, meaning you revise. And then you revise, throw it back again, maybe minimum revision, revise again, throw it back, maybe 4 or 5 times, 6 even, I don't know, depends on the team. But it's heavy on that kind of process, rigorous process about understanding the target audience. Now, the difference between the regular one and the ACD one is people is at the forefront. Now, without the ACD process, I still think that should be underlined every time you're doing any kind of health promotion intervention. People should be the center of it. Your target audience should be the center of it. You should understand them, and you should design the program based on their needs, solving their problem, not yours. You may have like a set of objectives when you start something, but then you figure it out so it's in line and it's interesting and it's beneficial for your target audience. Because if you just design something based on what you need, you just need to produce a PSA. You don't care if it works or not. Correct?
You just need to print a poster. You don't care if it works or not. But if you design based on what people need, maybe a poster can make a difference. Maybe a PSA can make a difference. But unless you flip your paradigms, it's not going to do anything. So, this is based on my personal experience. And please, you're more than welcome to add something to it. You may have like a 10-point list or something. And hopefully this is in line with the other two speakers. It's a quick one. Begin with the objective in mind. Sometimes you don't even know what is your objective. I recently have a consultation with a client and I asked them, okay, so what do you want to measure at the end of your program? Don't know. What can be measured? Okay, so what are you trying to do? Well, we want to do something very specific. Okay. Well, we want to try this and see whether it's going to make a dent. Yes, but you need to define what is that objective that you're trying to reach. Otherwise, we cannot plan how to reach it. If you need to go to another city, you need to define that city first and then figure out the way there, correct? That's logic. You don't just drive around and maybe we'll get to Jogja. Semarang. And the second one, plan how you will measure it. That's monitoring and evaluation. Because if you don't define it first, then you cannot measure it. It's very difficult to design something if you are not going to, you don't know how to get there and measure how you get there. Focus on people. That's the ACD. Empathy goes a long way. And this goes to advocacy as well. Sometimes when I meet somebody that I need to convince about a program, and this person can be like very annoying, very demeaning. I try to think, I try to put my shoes in his shoes. Okay, maybe he's bored in his job, doesn't know what to do. He enjoys, taking power because he doesn't have any power on anyone else. So I started thinking about, okay, if I want to propose something, what's in it for him or her? And that requires empathy. Like, why is he doing, or why is she doing things this way? Maybe I can get him or her to be interested if I presented certain things a certain way. It works for every part of the project. Really understand the issue and its context. I think a lot of people still plan health promotion as an issue in the vacuum. Like it's like a standalone thing. Okay, you want to do breastfeeding, let's promote breastfeeding, but you don't ask the question, okay, what's happening in the houses? What's happening in the families? What's happened to mothers? Why aren't they doing what they're supposed to be doing? Is it really because they're ignorant? Is it really because they don't care about their children? Because a lot of the times I hear health promotion practitioners start blaming their target audience. True or not? Well, I experience it often enough. It's like, man, they're so stupid. They don't understand this. If you design it correctly, they don't even have to understand. There is a chance that people don't really need to understand to do something. That stair/piano proves it. Maybe it doesn't work for every context, but again, study the context. Figure out what you can do within that context. And then the last one, I have so much hope for you, people, younger generation. Be curious. Do your research. Because I am having a hard time convincing health promotion practitioners or medical professions
to actually do the research in behavior. I am not asking about the statistic on the actual diseases, but we need to know why that happens. What behavior lead to that statistics? If you plan only by the statistic, only by the number of diseases, you are bound to lose your money. You're throwing it down the drain, you're putting it in the toilet bowl, basically. Because you are not going to make a dent. You need to understand why things are happening, what behavior is linked to it, before you can actually make an effective health promotion intervention. So last one would be, what can we do better? And that is why you have the second paper. The second post-it notes. This is not coming from me. Do you still have your paper? Right? Okay. We have more. Don't worry. You're not getting out of it. So who doesn't have paper? So like pass it on to your friend. I'm just going to break it up. Need one? Anybody need one? This is just something that
you want to do and then you're willing to do. I'm not going to check it. I'm not going to come back here in 3 years and ask, have you done the things that you write on the second post-it paper? No. But I want you to think about the things that I was questioning and maybe figure out 1 or 2 things that you want to do better if you are working in a health promotion field. Maybe in a year, or maybe you are already doing it now. But think of 1 or 2 things that you can actually do and you're willing to do in the future or right now if you are given a chance to plan and implement a health promotion intervention. Maybe do research better, make sure that you have the right data, make sure that you understand the context, make sure that you understand the behavior that is linked to it, make sure that you have the right objective, start with a defined standpoint, what is your objective, what is your monitoring and evaluation plan, whatever it is that you can think of and you are willing to do if you're given a chance to actually do health promotion intervention. Wow, it's quiet. Everybody is so serious. Good, because now that I look at all of you, I'm hoping that this is going to be a milestone in your education, and hopefully in the future you will make better choices in health promotion intervention. And with that, I would like to thank you for your participation. Thank you for writing it down. Sorry I went through a lot of time. Go ahead, no need to clap, just it's more important. Thank you. Ibu Judy, I'm giving it back to you.
Okay, I hope that we have been exposed enough with the struggle that all the programs that was presented by DY, retail, as well as the practitioners in many different projects, Tika, on doing health promotion being complex and it's not easy, but yet when your program is contributing on some sort of improvement, then that will be the reward, and if I would see it as my personal point of view. Now, because Regan is here, again, to make it not less formal, so why don't we just free-flowing. If you have questions to address regarding Regal's presentation or Tika's, or you would like to even ask something beyond, like asking for a collaboration, for example, you are talking to the right manager, because I am also the knowledge management and partnership manager. So
Anything you would like to address related to the talk that was, you would like to switch your chair, make it informal because this is too formal. It's the time because, I don't know, maybe this is just once a year that we have Tika. Rigel is actually here, but Tika and Diwa, we normally just invite them once a year, so basically, or sometimes like 3 years in a row. No, yeah. Okay. Apa namanya? Self. Okay. Okay, questions? Okay, we have one. Maybe anybody else would like to ask questions? Maybe I would like to save 2 questions. Me and Nurul and Ami first, maybe, yeah? Okay.
Good afternoon. My name is Nurul. I'm one of the master student at CMU. My question is, I wonder about your experience, both of you maybe, I'm not sure, because we know that Indonesia is really separate between the urban and rural areas. In your experience, has there been any difference when you are doing health promotion in urban areas and rural areas? Thank you.
Let's go to the second question first.
Thank you. My name is Ami. I'm one of the master student. And then what I want to ask about how to deal with this target of population, which actually before we try to understand them, we know that their characteristic, but how to deal if they don't want to change, they unwilling to do some behavior change in their life. Thank you.
Yeah, I think based on my experience, for sure it is very different. Let's say that in Indonesia, it's let's divide it into east part, west part, and also central part. Yeah, and somehow our government like to have one communication way for all the province from the Sabang to Merauke sama, but like back then we are very into IYCF, infant child feeding. Even the picture of moms wearing a hijab or not is a very sensitive in Aceh, while there is no problem at all if you use it in Papua. So yeah, this is also, that's why in BCC we always comes up with, when we preparing an information, first it needs to be relevant and also very local context, sensitive to the issue. Even with the colors, we don't want to offend any parties with some colors. That's why we need to come up with pre and post tests during the made of the design, the IEC materials. So yeah, like for the challenge here in Indonesia, like buku KIA, terus kartu menuju KMS, ya. It's always an issue with the baby. That's why somehow for just to prevent any harm, that's why they usually comes up with kartun. Illustration.
Not very definitive characteristics.
So yeah, so that's why later if we want to make an IEC materials, that kind of crucial things that we need to identify. Itu yang kedua tadi teh.
The question of people don't want to change. Oh, you have this all the time.
So here, because back then I also take a counselor 40 hours of 40 hours of breastfeeding counselor, and then as a counselor, one basic thing of being a counselor that we try to help them. the last decision should be comes from, yeah, it will be depend. I mean, don't feel sorry. What needs to be read, what we need to rethink, whether we already give the relevant or correct information, or even doing the right approach. So this is like an example. Back then when I was working in Timor-Leste, and the case of malaria is very high, and then they comes up with an IEC materials that the bed net is very important to prevent malaria, right? And then we are distributing very premium quality of bed net, and then no one using it. Why? This is before we don't know the BCC strategy, yeah? And then we ask, so I think this is part of the BCC. We need to know what is the burden. Why they don't use the bed net to cover their bed during nights? We need to know about it, and then we need to come up with the right message. Why do anyone knows about the reason why they don't use the bed? Huh?
Is it really expensive? They put it in the cupboard.
Because it's a very fancy things, and then it only can be used if they have guests. So at that time, the Ministry de Saudi, ya, kalau di sana bilangnya, oh yeah, we need to change. Then it should be used for the family members, no, not for the guests. So that's one of the examples. So no need to worry if they don't change. It takes time. Sometimes it doesn't have to be comes from us. Can be something, but as long we do the right approach and we try to stick with the process, I think yeah, it will be depend on the.
To answer the first question from Nurul about the difference between urban and rural area, and even suburban is different. So you have to take into consideration when you're planning, because it is challenging. It's very, very different. To take one example, I was hired to do a job to contextualize a message, materials on breastfeeding, and it was an urban manual developed by QUIS, Koalisi untuk Indonesia yang Sehat. It's no longer here, but it was developed by QUIS for urban setting, and then an NGO with an E, not E, wanted to use the same materials, but in their areas, which is, I think it was East Nusa Tenggara, somewhere in the, sorry, I completely forgot. Yeah, somewhere all of Timor, whatever it was. So we had to change even the illustration, the look, the message. We just used the same kind of logic. Skin color changed. Position changed. We have to change the information regarding how to store the milk, because they don't have refrigerator. So a lot of the things that you think is like given in an urban setting, you really need to figure out how to do at the rural level. And that takes research, and that takes empathy, and that takes, like the knowledge, in-depth knowledge and understanding of how the people, heads of health office maybe one of the sub-units in there, and we gave it to her, and she said, well, that's not us. We're not going to use it. What do you mean? Doesn't she look like one of yours? No, of course not. And she was like very sure, of course not. That is a different pattern of cloth that she's using.
Batiknya beda, patternnya. And we had to retake the photos just so she wants to use it. So those kind of things, maybe like when you're in an urban setting in Jakarta, you don't really go into the villages to figure this kind of things out. You just cannot predict all of the things that you think you know. It's given, you know. But every time you go into each area, you have to come in kind of with a clean slate, with a good framework, but a clean slate. You know what I mean? You have the logic, but then you test it. You figure it out. Where does these things go? In terms of how to change, is it a person or a community that? Community. That's a little bit difficult. I'm going to take, like, in 2005 I was working for UNICEF in their immunization campaign, and Banten was the province that officially said no. Province, official government office. So the reason was religious. Oh, wow, the sound effect is right on cue. They have the religious reasons to do it. And like I said, if we want to present a certain argument, we don't use our point of view, we use their point of view. So I remember we had to go into this like little villages where the official government wasn't really the king there, but like the ulamas were. So we just like go village to village and come in with our, you know, the ulamas from the national level and have the discussion. And they have this lengthy discussion about like quoting all the religious, you know, surah and whatever. And I'm like, no idea, I'm just going to sit there and pray that it works, you know, because oftentimes you have to understand as well that you might not be the right person to make that change. You know, if you're counseling somebody, and this is like this an example of at the individual level, you have a friend, you want to, because it was borderline anorexia maybe, and you know that if the suggestion comes from you, she won't listen. Because she's your friend, she knows that, you know, you're not going to be judgmental, you're not going to be reporting her, you know, so you are not the right person to make that change. And then you figure out, okay, what kind of profile that make this other person to make the change for her? Maybe, you know, convince her, maybe a boyfriend, maybe, you know, a teacher. So that is also another, even stranger maybe, you know, because sometimes a counselor who's a stranger, who doesn't have any vested interest in the case, would make a better change maker. So I think that would answer the question maybe.
There was another one. Yeah, there is. Is there any other questions coming from the right wing? Okay, good luck.
Yeah. Thank you for the opportunity. My name is Fudla from the Community Nutrition student. I am concerning about scaling up project. Basically, if we want to scale up one project to a bigger one, bigger scope, basically we will choose the same characteristic environment from the first one. So I am questioning about the one who doesn't have this similar characteristic with this one. Does it mean that we start from zero again? And what should we do then? Thank you.
I see that as a
She's working scale up.
And she knows why we are doing scaling up. We need to do that.
Another question? Can we take any questions? There are more questions?
Maybe I can ask sorry. I don't know, this will be something that would, a question that everybody asks when we do activities like this. When can you say that you have achieved success? Okay? Especially so when you deal with behavioral changes. Okay? And then, like, going back to the definition of health promotion, it starts with the word process. Yeah, a process could be very iterative, cyclical, or whatever, and then where does it begin and where does it end, considering the kind of indicators that you would like to see on your target audience, and considering the question like, it's a matter of choice. Because the word control is something a matter of choice. It's really by choice that a decision is made towards coming up with a behavioral change that we would like to see. I asked the question like, how much percentage you would say that your effort is success? Because like it could be like very temporary, like the stairs. You take this out, then you will go back the elevator, the escalator. Yeah? So but then again,
during the experiment, it's there. The behavioral change would be manifested. And the point is like, everything that we do is project-based. Project has duration, has funding limitation and things like that. So like, and that goes back to the question of scaling up. You know, these are all now put into one frame of like question, a never-ending question. That's why I said like, yeah, we will have much more questions. There's no quick answers to this one. But like, just to wrap it up, Tika and Rigel, like, you know, where can we say enough is enough for health promotion? And where do we say that, no, we have to sustain that? And who would sustain when all the people like you is not anymore in the scene?
Hopefully you guys will.
Yeah. Something like that. Just to provoke everyone's thought.
Okay, so and the question was scaling up and the sustainability. I think this always go together. Rigel can talk a lot about scaling up because that's what he's doing. He's actually doing, but it is a question and a very hard question, and I'm struggling with it myself. So whenever I have to design like an intervention, there's always this question about designing as a pilot or designing a project to be scaled up. Because those are two different things and two different purposes. The pilot has to be successful for it to be scaled up. And in Indonesia, the context is very different everywhere you go. And I always say to people, I'm very sorry if I'm being slightly biased on this, but I said to people, if you want to do something that is successful, do it in Central Java, Yogyakarta, Semarang, and those areas where you know culturally they're more apt to changes, they're more open to have, make better decisions. Together, communal, culture. And when you make the pilot in Yogyakarta and you successfully do it, then you scale up. Then you're in big trouble, because whatever it is that you're doing in Jogja is not going to work in Papua or Aceh. There's always going to be give and take. And I don't have a quick answer on this. And I usually do it on a case-by-case basis, because it's very different depending on what people are trying to do, what the project is all about. But in terms of sustainability, there's also a question. And this is a good transition point for Rigel, because I think Rigel's project is based on it's a scientific-based approach, evidence-based, that when you do things often enough, it will stay with you. So the premise of Rigel's program is you have to do daily for how long that's going to stay? No, because I remember because I was localizing.
So it's
context,
about saturating things.
No, it's actually making something into a habit that people don't think about anymore.
It's a way of life already.
It's yeah.
Habit is a way of life.
Yes.
What the nudging kind of thing.
Yes.
It's not nothing. It's not really new.
Yeah.
It's a conditioning Pablo theory,
Yes.
right? You know,
Yeah.
the condition stimulus response. But then again, when the stimulus is not there anymore, then it goes back again to the normal thing.
Right.
So that's why
Yes.
sustainability is always a problem.
Yes.
Without behavioral changes.
I think that's why monitoring is really important.
That's right.
Because then you measure when it gets to a point where it's like popcorn. If it doesn't pop anymore, you take it out and you change it to something new. So that's why like periodical check is really important if we opt to go into that kind of approach. So so that's the thing. The problem is we don't do such a good job with monitoring in Indonesia. Hopefully, it's not a culture anywhere, maybe, yeah. But I think that would be a really good way to check whether we need to shuffle things up a little bit and change the approach of whatever. I was going to say something, but I'm really blanked out. So, Rigel, you take it away and tell it again.
Yes, getting up. Phew. Yes, it has been like 6 years working with West Java and also specifically for Bandung and Indramayu. So I think we need to be really transparent with our partners since the beginning and focus. It's one challenge that in Indonesia it's very hard to do by only focusing on something like toothbrushing, hand washing, deworming, because there's so many issues that they want to tackle. This is also happening with the Ministry of Health. Every information, there is nothing wrong with the information. The question, is it relevant or not? Because there's a tend to, as a health promoters, we tend to give every information. Yeah. So we need to be focused first, and then why? Because so this is like an example. There is always yeah, like why GIZ working only in 6 schools? 6. West Java consists of 27 city and district, and you working only in 2, Bandung and Indramayu. And every time they comes up with that kind of question, I always try to answer, because we try to be focused. Why? Because later on, we will have an answer if the school is public school, if the school is a private school, if the school is 2-level stories, if the school consists of 1,000 students, if the school consists of 100 students, if the school is in the very rural area, if it is in the urban area, if the principal is changing. Those kind of things we can only get if we are focusing. If we, in the beginning, try to already work in, let's say, 100 schools. Once we fail, no one will ever believe with the approach.
I think as a pilot, it's always
important to develop the program as a proof of concept. So in terms of scalability, I would look at the initial program and I look not into the details, but like generally what works.
Yeah.
So you pick up several points that you think is an innovation and you find it as an insight in your pilot program, and then you figure out whether that particular insight can be implemented in other contexts. other cultural context. Because I know his program quite in depth, quite well. What Rigel is doing in his program is focusing on 3 things. And if he's going to do the same 3 things in other places, then the insight would be, making sure that the school is ready to match whatever he's doing with their own resources. I think that is an insight that you are doing. You find out while you are doing the project. You come in and you do it, and then always nothing happens because nothing was coming from them. They don't want to do and share their own resources. So I think that's an insight that he only found out while doing the project, and now that he knows, he's probably going to try that out in other places. Correct?
Yeah, and related to that, Batika, that's why we come up with first S is simple. Because if it's not simple, it can be scaled up. We need to come with simple things. And then if in the beginning you already comes up with 5 pages of monitoring form, even with 1 page you already have difficulties. That's why you need to think first. It should be simple, so it can be scalable in any area, and then specific. And also what I tried to mention in the beginning, we need to know our partner, because the indicator whether we should stop or not is after we are not there, the activity is still there.
That's the thing.
I cry because after 6 years something still happening in one elementary school, and for me that's enough.
Something is independently happening in one of the school. Out of 6, 1 is actually picking up the program and run with it on their own. So that's.
And also I think this is a very important issue about capacity building. It should because now we should thinking about someone who will be there forever, which is not us. Who? It will be the government. So we need to build the capacity of the institution, not the individual. So this is also the tips to be if you want it to be scaled up, it needs to be institutionalized. It needs to be in the system. So I mean, like this is the strategy that we try to build in Bandung, because they're always an excuse why they don't continue the activity, because the school principal changed, the head of that act retired, the mayor become governor.
And I'm just going to say this out loud. From management point of view, program management point of view, change is expected, people. So it's not an excuse to actually, when something doesn't work, you cannot say, oh, because people, the people are changing. Somebody's not working there anymore. You have to build that into the program. It's difficult, yes, I understand. I completely empathize with it, but from program management point of view, it should be expected, and you should have a plan written right from the beginning about those kind of issues, because it's always going to happen. So it's not a good excuse for program failure. I think
work more with the government. Yes, it's in their hands actually.
It's very challenging.
It's challenging, but work with our government, with the partner, and then try to somehow assist and then build their institutional capacity. So it's also an issue about knowledge management. Yang datang training siapa, training ini siapa kan bebenah. That's why we need somehow to give the example.
Curhat kita semua kayaknya ya.
Yeah, but no worries.
We're not
I
saying
think no worries. Yeah, no worries because what we need to have is a hope. So yeah.
Yay! Let's be hopeful.
Oh, every time I have a chance to meet with the other teams, the first thing we said is, "Hey, we survived." Yeah.
Shall we sing?
Yeah.
I will survive.
Okay. Yeah. So I think it's really a wrap. Yeah. I mean, the complexity that we have been discussing hopefully inspire all of the people in this room and all of the people who is attending this sharing online to be on fire. Because otherwise, if you are not on fire, you are dead. Might as well don't do anything related to health. So I think I would probably just close the session with that particular hopefully motivation that we can do when we work together. Partnership, I believe, was the key from DY, Reviews, and also Tika's presentation. So it's really about making nutritionists really working with other people. Yeah, so that ego, sectoral ego needs to be at some point, degraded or eroded at some point so that we can really make things happen. Okay, let's give applause to these two presenters. And then with this session, I would like to end and then hand the mic back to Tia for a closing.
Thank you very much, Ibu Yudi, Lydia, and Ibu Tika. We now come to the end of the panel discussion. On behalf of the committee, we would like to thank all the participants as well as the speakers and moderator for the success of the event. And we also would like to apologize for any inconveniences during this panel discussion. Hopefully this event will give a great benefit for all of us. For participants, for the information, all materials on PDF we will send you through email, and we will also send you the e-certificate of this panel discussion. By the way, okay, before closing the session, I would like to invite all of you to come forward to take a photo. Oh, yeah.